Okay, perfect. All right. So thank you everyone for joining us today. This is a meeting of the ANST Rehabilitation Neuropsychology Focus Group. I'm Amanda Weisinger. I am one of the senior co-representatives along with Coley, who will be joining us in just a moment. We also are joined by Gabby, our student representative, and Dr. Kristen Hamlet, our faculty representative. This meeting is being recorded. This is the first installment of a series that we're putting together talking about different pathways to rehabilitation neuropsychology careers. So today we're focusing on graduate school, internship, practicum, sort of those levels of training. So I'll let our panelists introduce themselves. But I just wanted to remind again that this meeting is being recorded. Feel free to unmute yourself and ask questions at any time. But if there is any question that you don't feel comfortable with asking in the context of this recorded meeting, feel free to directly message either myself, Gabby, Dr. Hamlet, Coley. We'll be happy to ask that question on your behalf, leaving you anonymous. So why don't we start off with our panelists? Jon?
Amanda, real fast, there's a Q&A function. So if it's working, please feel free to submit your questions there, and you should be able to submit anonymously as well.
Thank you, Coley. All right. So Jon, do you want to go ahead and introduce yourself to our group?
Yeah. So hi everyone, my name is Jon. I use he, him pronouns, and today I'm wearing a navy collared shirt. I'm here today to kind of talk about my experience in rehab psychology. I just finished my postdoctoral fellowship at the Minneapolis VA in rehab psych. I was at UW for internship where Humza is now. And before that, I was part of the Illinois Institute of Technology for grad school where Gabby is now. So I have gone through some of the span of training and explored areas towards rehab psychology, away from it. And so I'm eager to talk with all of you today to share what my experiences have been, and hopefully that'll be helpful to somebody.
All right, Humza.
Hi everyone, I'm Humza. As Jon was saying, I'm currently the Rehab Neuro intern at the University of Washington at Seattle. I'm from Illinois Tech in Chicago, and my experiences are probably similar to Jon and Gabby. I'm happy to share those as well.
And we also have Timea.
Hi everyone, my name is Timea Tozier. I am the current Rehab Neuropsychology intern at Baylor College of Medicine, Tier Memorial Hermann Rehab Hospital. I was previously getting my doctorate at Wright State University in Dayton, Ohio. My pronouns are she, hers, and I'm wearing a mint green sweater with some silver buttons.
And then finally we have Kimberly.
Hi everybody. I go by Kimberly and use she, her pronouns. I am currently the second year fellow in the rehab psychology track at the VA Palo Alto, and I'm looking forward to answering any and all questions today.
All right, so if anyone wants to get us started, if anyone has any questions, otherwise, we're happy to facilitate by asking some questions as well, but want to open the floor if anyone had any initial questions for any of our panelists.
Hello, I guess I will just unmute myself and ask question. I am looking for an internship with both neuropsychology assessment experience and rehabilitation. But when I'm reading through the APIC directory, I'm wondering, like, what would you look for to make sure that the site actually provide cognitive remediation experience? Because one of my instructor mentioned specifically to me that some sites that they do provide that, but they actually don't do it.
So it sounds like you're specifically wanting experience doing cognitive remediation.
Yes, and I'm interested in looking into rehabilitation in general as well.
Okay. Yeah, I could see how that would be challenging to really decipher. Just kind of taking a step back a little bit and speaking more generally first. For me, it was important to make sure that the internship met all of the kind of baseline neuropsychology requirements so that I was staying on track for board eligibility in the area. So I was always looking for that as kind of my starting point, and then looking for rotations and experiences of that internship in rehab settings. So specifically working with certain populations of interest for rehab, or even, even for me, more ideally in inpatient rehab settings, since I was particularly interested in that kind of exposure. And sometimes I would see it mentioned that there was some opportunity for cognitive remediation, often in outpatient rehab settings, I would say. But it wasn't always very clear from the brochure, so it might be something that you have to do your best deciphering and then follow up with either an email ahead of time if it's really important to you to only apply to those kinds of sites, or ask more of those questions during the interview process once you get to that stage. Other panelists might have more helpful guidance.
Yeah, great question. So I come from a rehab psychology perspective, less on the neuro side of things. But a lot of the brochures will detail if there's cog rehab that's involved in some of these programs. So thinking about internship, that's where you'll see quite a lot of that. And I think really it was on interviews. I think I heard most of those things. I'm curious to hear about, what the driving reason is for having experience in cog rehab, as a lot of our roles and responsibilities when it comes to cognition overlaps with a lot of other folks on the team. So let's say you're working with a speech therapist or an occupational therapist. They may be doing elements of that work and you may be involved with them to that same degree. So I think it really depends also on the site and the facility and what the aims are for treating the patient too. Yeah, I don't know if I've heard anyone who finds that cog rehab is the necessary thing to have for experience. But I guess I'm also coming from the more interventional side of things rather than the neuropsychology side of things. But that's just my experience on those things. I could certainly talk about other ways I found internships and postdocs when it comes to rehab psychology as well.
We got a question, an anonymous question here. So can you explain the difference between neuropsychology and rehab neuropsychology? And then maybe adding on to it what your definition is of rehab neuropsychology or experience with that. And then panelists, might be helpful to hear how you got into it too.
Before we move on to that anonymous question, can I answer or provide my 2 cents? So I didn't introduce myself, but I'm a neuropsychology assistant professor at the University of Florida. And I tend to see myself in this neuro rehab kind of space in outpatient and inpatient roles. I think 2 things. If you're looking for cognitive remediation experiences, that can take on a lot of different forms. The term cognitive remediation is usually used in a very broad, holistic sense to say, how are we going to improve cognitive functioning. We could do that by training cognitive networks. We can do that by decreasing emotional distress, decreasing autonomic like reactivity. So cognitive remediation can be anything that's final goal is leading to improvements in cognitive functioning. So that's one thing to kind of realize. A lot of people are going to use cognitive remediation, cognitive rehabilitation, those kinds of terms interchangeably. So if you're seeing that in like, if you want that experience, usually you're going to get that in more of an outpatient intervention kind of setting. And what I would ask people when you're interviewing or reaching out for experiences is not just do they provide it, but how often do those referral opportunities present themselves? Because your access to patients who would benefit from that or who are going to be referred for that is going to be really variable from place to place. So if you want to ensure you're going to get that experience, I think that's a good place to start. That's it.
Thank you. That's very helpful.
Thank you, Kristen. I think it was really helpful to hear that. And actually, somewhat answers part of this question is like, there are a lot of different definitions. And so really helping clarify like cognitive remediation and how that can fit under this umbrella of rehab neuropsychology. So just going back to this other question of like, what is the difference between neuropsychology and rehab neuropsychology? So we heard about cognitive remediation, but maybe hearing from some of the panelists about how you would define each and what your experience looks like within it and how you maybe got into rehab neuropsychology in the first place.
In my opinion, the difference is primarily either the population that you work in or it's the application of the strategies themselves. So as an intern at UW, I've been doing more of like the rehab psych within neurological populations, as well as the testing and the recommendations, but it's been a lot more adaptive and it's been a lot more like engaging in specific recommendations that an individual can use as compared to just doing an outpatient evaluation within like neurological populations. I also consider like the rehab neuro and the rehab component as like just the application of neuropsych and the hands-on stuff you can do. That's very different from just like the normal day-to-day neuropsych that you'll see. In terms of exposure, Illinois Tech is known for their like rehab program and rehab psych as a whole. And so I had exposure with rehab through classes that were available. I also did a practicum experience at a VA doing spinal cord rehab. But it wasn't necessarily intertwined with the neuropsych component until I got to internship, just because there are very few opportunities to do so. But I was able to take my skills as both for both rehab and both neuro and combine them to be able to apply them to specific.
Yeah, I echo a similar definition of rehab neuro. I also think about it as like the setting and the application of this kind of assessment and intervention. And it's really thinking for me is about like the intersecting variables of cognition, behavior, mood, and the environment to help inform our understanding and the people we work with's understanding of how they navigate the world. And I think especially in rehab, it's this kind of like our panelists said. Of this like true application kind of in work in front of us, especially when you're on inpatient rehab. And for me, how I got into rehab neuro for myself is through a shadowing experience I had as an undergraduate on an inpatient rehab unit with a neuropsychologist. And then after my master's degree, I worked as a psychometrist full-time in a department of physical medicine and rehab, so inpatient, outpatient. And that kind of really ignited my passion for the field and trying to make sense of, how does rehab and neuro work in tandem.
Yeah, I had a fairly similar journey, and I think the definition of rehab neuro and those words can be combined in different orders, and to me really changed the meaning. But rehab neuropsychology, in my mind, is really, again, the practice of neuropsychology within those settings, populations, or the way that you're applying the work. So I know some people who do full-time outpatient neuropsychology and still consider themselves rehab neuropsychologists in the way that they focus on and implement the recommendation side, and maybe even kind of straddle the line into a little bit of intervention. So I think that's kind of the one maybe extreme as far to the side of neuropsychology as you can get and still be a rehab neuropsychologist. But I think often it looks like neuropsychology practiced in rehab settings or with rehab populations. For me, that's more what I wanted, and I wanted kind of the acute inpatient side of that. I also first kind of identified the career during undergrad by getting a shadowing experience, and then had to struggle to figure out what kinds of experiences along the way could help me keep growing in that area. And it wasn't always the most straightforward. So I had one practicum experience working with neuropsychologists in a rehab hospital. Other than that, it was a lot of, I did some kind of behavioral medicine sort of work to stay active in more integrated health settings. I did some sports psychology work because I found that there were a lot of parallels in the ways that, well, first of all, the opportunity to work with people who underwent injuries and then had to rehabilitate. But aside from that, even with other athletes who weren't injured, the opportunity to work on different performance goals and functional goals with them in a similar way. So yes, it was a lot of piecing things together to get there. And I'm happy to answer follow-up questions on that piece.
Thank you all. And, it sounds like, generally speaking, it can be a variable definition, but it just really depends on setting, population, and there are a lot of different options for that. And I think that is really important to highlight because it's something that people, myself included, I wasn't aware of that until more so later in graduate training, internship, and postdoc. And so thank you for highlighting that. Julius, I see your hand raised.
Hey everybody. Hey Coley. So I guess my question evolves, I guess, from just the esteemed panelists and the way you all broke down as I'm reflecting on what is cog rehab or neuro rehab, I wonder because this, I guess, what is the future of neuro rehab? Because as I reflect on my practicum experiences, I had a practicum that was at the VA in Martinez, and it was more noted as cog rehab, and it had an outpatient and inpatient component. And I'm thinking about it, and as I'm hearing all these definitions, I'm like, wow, they're closer probably to more rehab stuff. You did do actual interventions, but it was it seems like it was more working with the team and the recommendations, even though I was working in the outpatient wing. But then I hear other places that may say, oh, we do cog rehab and stuff, but it's more like the speech therapist is doing that. And that's also something that I was hearing specifically. So I guess I say all of that to say, I'm wondering what is the future of a neuro rehab practitioner? How is that evolving? Because that would inform how I want to pursue this career or this path. I don't know if that makes sense or not.
it's really hard to have like a finger on the pulse for how things are evolving in the field, especially if you're getting training in different healthcare settings. At the VA, there's a lot that we can do to ensure that our veterans get all the care that they want and that they need. And then in the private sector, we have a number of different limitations that, can shape whether or not someone gets care in some of those areas. Yeah, I'm curious too about what all those things look like because I've been settings where, speech therapy or occupational therapy, they're largely responsible for cog rehab and some of those elements. And other settings, like at the VA, I've seen a number of neuropsychologists and rehab psychologists or neuro rehab psychologists or whatever combination of terms you want to use, um, take a lot of that responsibility and build out programs to really help folks, make those transitions in their lives. So I think all that's going to be quite dependent on where the area is, like where you're training and what sort of hospital system that you're a part of. But I do see that, there is a clear overlap in these skills and these interests of neuro and in rehab, cognition and rehab, and all those elements, and what that means to have a flourishing life with a disability. So it's hard to parse those things out, but when it comes down to billing, sometimes that can be quite limited. So I really do think that is dependent case by case, but I don't know. That's my hot take on it. And we're pretty close to where you guys are too. I just finished my fellowship. I'll start my job in the winter. So you guys are like right behind me in terms of what that looks like. So we're all kind of wondering what those things are. But there are plenty of folks who are publishing on the topic of neuro rehab and how those things are evolving. I have a peer who has a Google Scholar alert on their account to just ping them whenever neuro rehab or whatever combination of those words pop up, just to see how things are continuing to evolve and grow as we're trying to make a place for us in healthcare. But yeah, that's my long-winded answer to your question, Julius.
Yeah, and just one of those articles I'll pop in the chat. Let me know if that doesn't open for any reason. But there was an article that came out last year, Stuckey and a lot of other colleagues about training in neurorehabilitation psychology. So I think that it is something that's starting to take hold and take shape a little bit more, whereas for a long time it's just been because individuals have been interested in the intersection of the fields. And so they've just kind of carved their own path, as you're hearing. But now that there's enough of us in this area and enough of a need for practitioners with expertise in this area, I do think that there will be a little bit more emphasis placed on trying to guide the training process and what specific competencies are required for work in this area. So I'm hoping that we're kind of at this turning point, I guess, in how defined that is. But just one more point on that topic is that for me, when we transition to talking about a neurorehabilitation psychologist, it does change a little bit the emphasis. And I don't think that everyone sees it that way, but the way I see it is that that's a more of a rehabilitation psychologist practicing with neurological populations. So all of these like changes in terminology are so nuanced and subtle, and there's not a ton of agreement or like specific definitions out there to look up. And so I think there are a lot of people like me who are sort of making them up how it makes sense to us. So again, I'm hoping that we're kind of at this turning point where there's more clear and evidence-based answers to a lot of these questions.
Yeah, building on what you're saying, Kimberly, I think Gorgas and Tackett had an article that came out a couple years ago about the pathway into rehab psychology, and most people don't find the field of rehab psychology until during internship. And so it's awesome that a lot of you are exploring it, and also really common that folks are discovering later on, wow, I have a lot of these really awesome skills, generalist, specialist, that really intersect nicely in the world of rehab. And I'd like to build a career off of that. I think it's a common theme for that to happen later down the line. And I think that's also okay for that. And awesome that you guys are finding it early too, because that means you can spend time building all of those skills, getting you ready to really explore what sort of career you want to have for yourself.
I'm gonna hop in just really quick. I know I'm not a panelist, but I just wanted to share in terms of like thinking about, I love what you said, Julie, about like what's the future of rehab neuro? Like what does that kind of look like? And to me, when I think about that, something important I just wanted to share is that rehab neuropsychology, to me, yes, it's the settings that we work in, it's the patients, you know, that we work with, people with traumatic brain injury and stroke and other neurological illnesses, life-changing, you know, injuries. But it's also the way that I conceptualize neuropsychology patients. A lot of neuropsychology settings specifically, maybe they just see patients in an outpatient, you know, setting. They're just getting referrals from the same provider, and they might not even be providing feedback to the patient. It's just a consult-based service, and they're just performing the evaluation to give the referring physician that data. But for me, you know, rehabilitation neuropsychology, even if it is in an outpatient setting, I view that as an intervention. I'm doing the assessment to then have a feedback session with the patient where I'm going over the results and talking about my recommendations and how those fit into that person's life specifically. Are they trying to get back to work? Are they trying to get back to school? Are they trying to return to meaningful hobbies and activities? How can we make that happen with their current cognitive abilities? And do they need additional intervention like cognitive rehabilitation services? And so for me, I think rehab neuropsychology is kind of that state of mind, so to speak, like really like regardless of what setting you're working in, if you're inpatient, you're outpatient, you're working in a, you know, department of PM&R, you're working in a department of neurology. It's really just taking that comprehensive approach that's different than just other types of outpatient neuropsychology settings that I've worked in before in different hospitals. So I'll jump off my soapbox, but just wanted to add that. Thank you.
And we've also been, sorry.
Go ahead.
We've also been talking a lot about it from a clinical perspective, but if you think about what's ahead of us from a research perspective, there's a lot of, and Coley, you've been involved in these kinds of things. There's a lot of rich intervention work going on to supplement some of the cognitive training we're doing. You know, anything that's goal is to move us closer to improved functioning when functioning has been lost can be conceptualized as rehab. So some people are, you know, using different new technologies as a way to maybe optimize the strategies we have now, or we're refining strategies so that they work for larger groups of people, or refining techniques so that we're individually tailoring them to people better. Yeah.
I really love this question. I also think this is prime opportunity to highlight that, you know, this focus group was born out of people that want to, you know, bridge the worlds of rehab neuro and just highlight the other opportunities and where this field is going. In this Zoom and on the panel, we have a lot of representation, but from both Division 40 as well as Division 22 for rehab neuropsychology or rehab psychology. And we actually have some leaders within the student leadership network for Division 22 here. So, you know, just thinking about how ways to have your finger on the pulse is also sometimes, you know, involvement in those different organizations, thinking about ways to bridge the two and attending events like this. So I just want to highlight, you know, Timea is the incoming chair for SLN. And we actually have Maddie Pontius here, who is our liaison between Division 40, so ANST and SLN. So there is that growing effort as well. And Jon, I believe you're also past SLN chair too. So we have quite a representation here. So I think Gabby put in the chat the website for SLN as well if folks are interested.
Oh, hey, Coley, this is Sasha.
Hi,
Hi,
Sasha.
I love that you plug kind of involvement in leadership. I'm just so everyone knows, I'm a staff member at VA Palo Alto and the training director for our rehab postdoc. So I'm also the chair of CRIPTIP, which is the postdoctoral, like the rehab postdoctoral programs for the nation. And we are actually recruiting for a student member. So if you are interested in serving, oh, I should turn my video on so you guys can see me. Okay, hi. So if you're interested in serving on a leadership role and being a student member in rehab, please, I'll send out the contact information of who you can send your name to and then a little bio. Thanks. That was my plug.
Yeah, if anyone's looking for, hi Sasha, by the way. If anyone's looking for postdocs or internships that are going to line you up towards board certification in rehab psychology, the CRIPTIP list is really helpful. It gives you a list of folks who participate in that program. And that was one of the ways that I found programs to apply to for internship and for postdoc.
And I will echo, obviously I'm a little biased because I'm the, incoming chair for SLN, but I think coming from a program that didn't offer any practicum experiences in rehab, I found that leadership opportunities to be really helpful in terms of supplementing my experience, keeping kind of a finger on the pulse of what's going on in the field, but also having, if financially possible, attending conferences as well to kind of help stay abreast to what's going on in rehab. I think that really helped curate my experiences. And I think another piece, especially if folks are navigating practicums and maybe there aren't as many rehab or neuro rehab practicums at your institutions, is to think about what are the qualities of a rehab neuropsychologist or neuropsychologist who's a rehab, whatever kind of combination as Kimberly shared. What are those qualities that stand out that are important to you for internship? So for example, for me, one of my first practicums was, or I'll share my second practicum was at a standalone psychiatric hospital where I did residential neuropsych evals. But that part for me was important because I had an opportunity to be a part of multidisciplinary teams and share feedback with different team members and be a part of the feedback with patients on those. And I think that's a really important quality, at least for me, when I thought about what does Rehab Neuro stand for and how do I see my practice moving forward. So I'm curious to know if other panelists have found different practicum opportunities that kind of help guided their experience. And sorry if I kind of stole the angle, Coley, so you could cut me off too.
No, that was, I think, one of the next questions and something that folks have been alluding to is like, how do you get those experiences if they're not readily available? I think that's something that's really common is there's no formal practica at a lot of places that you can get this experience. So if other panelists or to me, if you wanted to elaborate on ways that you were able to supplement your experiences that were required for your graduate program or to seek externships, practica, and also what you're looking for internship in order to make sure you get that rehab neuro experience.
I was really lucky. I had I want to say 5 or 6 month experience at Marion Joy Rehab Hospital through Northwestern in Chicago. It's an acute rehab setting on the northwest burbs of Chicago. And I got to experience TBI and stroke rehab and a little bit of SCI rehab in the inpatient sort of environment. The pandemic unfortunately cut that experience short. And I know for many of you who trained starting during the pandemic, a lot of that was quite limited. And of course, if you're not located in a large city where many of these acute rehab centers are hosted, you do have limited access to inpatient rehab care. You might have some experience to, experience for like transitional rehab or vocational rehab, things that set up the person with disability to flourish in life after experiencing an acute life-changing injury like that. But it's hard to find those experiences early on. When I reflect on my experience on postdoc, I think actually some of the things that really helped me the most was my generalist background and my neuropsychology background. My neuropsychology background, I had I had one practica and then I teched for 2 years. in neuropsychology, and then I had some community mental health experiences. Those gave me a really strong foundation in thinking about, how does the brain work? There's a lot to really understand about neurology and the brain neuroanatomy and cognition. And you really don't get that depth of knowledge about that outside of the neuro setting. And then community mental health just really helped me be a really good therapist. Really understand ACT, really understand CBT, basics of MI, et cetera, things that are going to help folks make sense of this really catastrophic event and make meaning out of it, or to grieve it if there isn't a sense for meaning available. And so I think those things really help build that foundation so that once I moved towards specialty training, I had a really firm rock to build off of. Um, so while the specialty training on practicum was like, wow, that really sparked it for me. That's where I was like, when I'm at bedside and I can meet you at this time of life, that's just shitty, is a horrible time of life, but I can help scoop a little bit of that suffering off the top. That's what really excited me about this work. Working with the team and interacting with them in that setting to really help intervene with the patient at that time. That sparked the interest for me, but I would not be very good at this job if I didn't build that foundation first. And so, wherever you're at, I really do think building that generalist foundation is really going to help set you up. Now I'm speaking from the bias of rehab psychology that doesn't require that you have X number of experiences before you go towards boarding. And I find that neuropsychology really does encourage folks to build up a lot more neuro in their basis. But if you're looking to do some rehab psych, I think some of those basic interventionist skills and knowing how to encounter that catastrophe at that time is really, really helpful. So that's my experience there.
I want to echo what Jon said with my own experiences. My first practicum was actually at doing psychosocial rehab for severe mental illness and doing a lot of those intervention skills for people who want to adjust back into or have a better, better opportunities and skills in order to go back into the normal community. And so I took those skills, and then as a practicum student doing spinal cord rehab at the VA, I was able to merge them together and doing some inpatient evaluations as well. But Jon's 100% correct. When you're working with these patients and you're doing the evaluations and you're trying to help them afterward, providing them with the skills through a therapeutic modality is the best you can in order to make them successful. And I think we often think that it has to be this super specialized area, and it really doesn't. It's just the skill building, and you probably have learned a lot more rehab skills than you think just based on your therapeutic experiences alone. So just being in populations that are different, being in populations that are a lot more adjustment, that are a lot more like return to work, return to school, will help you manage and be successful in a rehab neuroscience experience.
And I think also just asking if there are opportunities can also be helpful. At one of my first practicums, I was doing therapy for medically complex individuals and then bariatric pre-surgical evals. And there was a rehab psychologist just happened to be in the same department. So I just asked, can I start shadowing you? And worked a deal with my supervisor so that I did get some of those experiences. So it doesn't hurt to ask and see if there are opportunities out there.
We're talking a lot about clinical work. You also have to remember like some of these professional network things like the Student Leadership Network, for example, are also important things that can help you out in those areas. But research is a big one too. If you're working on research in disability populations, that is something that I'm often looking for when I see applicants. And also advocacy-based work. If you're involved in things that are advancing the lives of people with disability and reducing issues of ableism, ageism, et cetera, improving access to healthcare, all of those things are things that are bringing you closer into contact with people who are on the ground experiencing some of these challenges. So those are important things too. Maybe not as high on the list in terms of things like internship or for postdoc, but are still important things that I pay attention to and look out for. Like, okay, this person's attuned to the things that are impacting our patient populations.
Maybe we can move on and ask our panelists to share a little bit about what they personally prioritized for internship applications. I know there can be kind of this divide of, you know, do I want to focus more on like a neuro heavy internship? Do I want to get these rehab type experiences? It can be sort of a fine balance. And so I'll open it up to the panelists to share what your personal experience was like in kind of crafting your site list and what you were looking for in internship sites specifically.
I was looking specifically for inpatient experiences. I'd had a heavy neuropsych load to begin with, and the experiences I knew that I wanted to do this, but because of the lack of opportunities with rehabs, I wanted the ability to do inpatient, but I also wanted the ability to just fine tune my intervention skills in a rehab setting. So any place that had rehab, either outpatient or inpatient, was great. There aren't many, unfortunately. I'm like 8 to 15, if I remember correctly. And so just having the populations and like, so for example, UW has 2 different rehab at a large AMC, but also at a level 1 trauma center. And so being able to do both inpatient and outpatient was something that was very important. And for the neuro perspective, you need some, of course, especially if you're going for a fellowship, but it doesn't have to be the main portion. And I think that's sometimes a hard pill to swallow, and being like, hey, I'm supposed to be doing this, but why isn't it consistent with what I'm looking for? People usually know that you're going to be a good neuro candidate, especially if you've had the experience. You don't need to go all in on that, and you can try to get those extra experiences that you might not be able to get later on. So that's what I really prioritize. Whereas, like, what else do people offer that I haven't seen before?
Yeah, I think I echo that as well. You know, when I was obviously there's certainly so many factors when considering what internships to apply to, but certainly one of the things I was being mindful of are whether the sites aligned with the, Houston conference, Baltimore conference guidelines, and making sure that those kind of aligned with, for me, both rehab and neuropsychology. And similarly, I was looking for inpatient rehab experiences, working with interdisciplinary teams. I like the idea of having opportunities for research. And then the piece for me that really speaks to an article, and I'm going to have to find it and I'll put it in the chat. There's an article that recently came out that talked about adding another principle in rehab psychology, and it's advocacy. And for me, looking for a site that had a strong commitment to diversity and social justice advocacy above and beyond the requirements indicated by APA was really important for me, because I think it really speaks to the blend of neuropsychology and rehab and what our job is as providers.
Yeah, I had kind of previewed my answer to this question a little bit, but similarly, I really wanted to make sure I stayed on track and kind of kept the most options available to me after internship. So for that reason, I wanted internships that were consistent with both Houston and Baltimore guidelines. For internship, knowing that it was a year, and I had some flexibility in my life, I really applied broadly so that I could kind of choose the training that was most specialized. And that's what my priority was at the internship level. Whereas for postdoc, not only were there more sites that had the rehab and neuro integration, but I also was at the stage of my life that I really wanted to prioritize region more when I was applying. So going back to applying for internship, I chose settings that would allow me to do neuropsychology in rehab as much as possible. I don't even think I could make a full list of those sites. And so I ended up with some on there that I would have done some rotations in more of a traditional outpatient neuropsychology setting, sometimes with like more of an emphasis on a neurological population. And then I would have had other kinds of intervention rotations in health settings so that I could continue flexing those skills, and they would have kind of happened separately throughout the year. I did end up going to Mount Sinai where all of that was combined. So I was in a rehab department practicing neuropsychology, both outpatient and then inpatient, for one rotation with spinal cord injury and then one rotation with traumatic brain injury populations. So that's how I kind of navigated it. And my list in the end, ranking wise, ended up with like the sites at the top of my list being more integrated programs. But I think it was helpful for me to know not all of the sites on my list could or needed to be fully integrated sites.
Yeah, for me on internship, I had the range. I mean, because it was, I think my internship year was during the Delta and Omicron waves. So right before, I had everything kind of cut off. I didn't really know what I was going to do because I had like half of a practicum. I had a taste of rehab, I had done some neuro beforehand. I wasn't quite sure what I wanted to do career-wise. So just like what folks are saying, I was looking for programs that had that Baltimore, Houston guideline options available for me that could combine both of those to some degree. I was also like pandemic burnout and was like, whatever is going to get me a job at the end of this, like I'm happy with that. So whatever is going to get me out of my grad school program and into the real world, cool. I was really happy with that. So I had a range of like, things in like small town Missouri up to, other places too. And internship was really kind of where it settled for me. There were some elements in neuro that I liked, but I don't know if I could build a career off of this. It's not my passion. There are other elements of rehab that I knew I really liked, and I wanted to build a career off of, but knew that, oh man, I'm going to have to really work on some of these things in order to thrive in this environment. And so on postdoc, I was really looking for places that would deepen my skill set and my knowledge base and also my comfort working with some of these populations. And so for my postdoc search, I was really narrowing it down towards the rehab experience. And kind of like what Kimberly was saying too, like postdoc for me, the question became less about, am I going to find a site that can help give me this rehab focused experience, but is this going to build my quality of life? Am I going to find a place that, yes, checks off the skill set and this knowledge base that I find is important for my career, but I also want to find a place that helps me get a sense of who I am professionally and to just build my life. So on internship, I was less picky, and then on postdoc, I was more picky, and then on my first job, I was even more picky. So I think you can, kind of reclaim more back as you progress through things, because in grad school, you give up so much just to get to the end of that finish line. And as you progress through things, you can say, oh, I want that back. I want that back. And you can get it.
Just one other thought. I think that a lot of us on the panel had the rare privilege of having pretty clear interests by internship, it sounds like. And I don't think that that's necessary to be really successful in this field or in adjacent fields. So I still think it's totally fine to be exploring during the internship year. And if that's your goal, then I would be looking for kind of gaps in your training or sites where they have really varied opportunities to work with different populations and in different kinds of ways as a psychologist, so that you can try on different hats. And I still think that can end up setting you up well for a rehab neuropsychology career in the end, if that's what you still kind of lean towards. Even in the more specialized internship I did, one of my peers started out pretty confident that she wanted to do rehab neuropsychology, and then she ended the internship year much more kind of general health psychology minded. And so her postdoc took a turn in a different direction for her. So yeah, I think whatever you need to explore at that stage to really feel like you're getting what you need to get to the next career step is totally great. And then postdoc, I think, tends to be a little bit more specialized.
You're not limited on postdoc either. On postdoc, I had wonderful mentors who saw that there were things that I wanted to explore more and other things I was dissatisfied in, and gave me opportunities to carve out little areas in my career to see what would taste good on the plate. And for me, that was doing like quality improvement work and working on provider well-being, thinking more of the realm of kind of like IO, maybe like EAP sort of type of psychology. Um, and that was really, really fun. And that really informs a lot of what I do on the team setting when I work with other providers. And it ended up not being a career route for me. I applied to a second postdoc. During postdoc was to try to build out more of these ideas for myself. And I found that that was not something I wanted to do ultimately. But that's what all this is for, is to really take your time to get your feet wet and to really enjoy where you're at and to learn quite a lot. I found that in times in my career where I really tried to push back because, oh, I didn't want this rotation, or like, oh, I don't think this is for me. When I started off that way, I really didn't gain a lot from that experience. But I'm thinking about like a pain psychology rotation, where like I really didn't think that it would be for me. And it ultimately didn't. But when I really tried to sit in it and try to absorb as much information as I can to really think about how can I apply this to some of these other populations or passions or interests of mine, that became really, really great. And so for those of you going towards internship, if you don't get on whatever, ranking or list that you're at, like that is still, foundational training that's really going to set you up for that success. So it's a stressful experience, and I know I was there, and I also just remember talking to so many people about this of preparing for internship. And wherever you're going to be, it's going to build some of that foundation, and you can continue to carve for yourself these skills as you move forward.
Well, we are coming very close to the end. So before everyone goes, I have a feedback form, and then I also wanted to give Maddie just a quick little second to share about her role. She is a liaison officer between Division 22 and this focus group with ANST. And so I think it could be helpful if she talked a little bit about her role, and a little bit about SLN. And Timea, if you would like to as well, since you're the incoming or current chair now, that would be great. Okay, incoming. That would be great. But I'm gonna go ahead and post this link really quick too. It takes like 5 seconds to do. It's like 4 questions. If everyone would please fill that out. Yeah, thank you so much to all of our panelists. This was really helpful. I know even for me, I'm still in practicum training and I'm not applying to internship until next year. It's really nice to be able to learn from all of you and to hear about a number of experiences that are so different. And so thank you all. And Maddie, if you would like to kind of jump in. Sorry to put you on the spot.
No, you're all good. Thanks, Gabby. Yeah, like Gabby said, I am part of the Student Leadership Network for Division 22, and my specific role is to be the liaison between Division 22 and Division 40, specifically this ANST Rehab focus group. And Timea and Jon, jump in if I miss anything about SLN, but it is the student group of Division 22, so focusing on rehab psych, but I think most, if not all, of our members are neuro rehab folks. So there is a significant overlap within the Student Leadership Network. And I think this event is the perfect example of how Division 22's SLN and the ANST Rehab Focus Group are really trying to bridge the gap between these specialties because like we heard, and like we all know, training in these areas can sometimes feel siloed. So we kind of have the joint effort of continuing to host events and professional development opportunities for students in these areas. I don't think I have anything else to add besides I'm right there with you all preparing for internship and the stress that might come along with these, trying to find the perfect training opportunity in these different areas. So I hope that we, in collaboration with ANST, the SLN, can find creative ways to support you all. And also we're always open for ideas for other panels and discussions that would be helpful too. Did I miss anything, Timea or Jon?
I don't think so. I would just say, you know, through Division 22 at least, and I'm sure this also happens through ANST and Division 40. Getting yourself involved in some of these things was one of the most like career building things for me. It really helped me feel like I was professionally connected and felt like I was part of this discipline. I found a professional home in this area. It gave me a chance to get connected with people like Sasha through CrypTip, through Quinn when she was in CrypTip, and others like through the mentoring committee, advocacy committee, science committee, etc. And so it really connects you to folks who are all, you know, doing this type of work, and expands, you know, what you need and who you can rely on. So if anything, I will say the Student Leadership Network has been really good at getting people connected to folks in the field. So I don't want to toot my horn too much, but if you would like to get involved, you're more interested in rehab psychology and getting involved as a trainee, that's certainly a way that you can do it. Feel free to reach out to me. Timea is also going to be your best resource for that. So reach out to me if you want to, but I'm going to let Timea take care of that.
And I'll plug our Instagram. If you are on Instagram, we also have an Instagram account that you can follow where we post some information and resources for trainees as well. So, but thank you, Jon, and thank you, Maddie, as well.
Thank you everyone for, engaging today. Thank you to the panelists for your invaluable insight. Loved hearing about each of your experiences. And also, just like Gabby said, we have the survey link in the chat. Let us know if you have any difficulty with that. And then I'll also just plug that this is part 1 of a 3-part series. So really thinking about how can we tailor training across stages of training and across stages of your career. So this one was really focused on practica and internship. We heard a little bit about postdoc, just naturally, that's all, every stage is on our minds. But the next one will be focused on postdoc, fellowship, and the next one will be about early career considerations. And within those next 2, we'll also be adding in considerations for ABAP, so dual boarding or choosing, neuro, rehab, board certification. And so if you have any questions, please feel free to reach out to any one of us. Also feel free to reach out to us via our Twitter or X as it's called. And we'll put that in the chat as well. But thank you all so much. And looking forward to continued collaboration.
Thank y'all so much. Appreciate it.
Thank you.
Thanks, y'all.
Thanks.